Good evening and welcome to the April meeting of the Knox County Commission. Welcome to the meeting. For those of you who are joining us through either CTV or community television, thank you for tuning in. Before we begin tonight's meeting, I'm going to ask the County Clerk's Office to call roll.
Commissioner Gill.
Present.
Commissioner Carringer.
Present.
Commissioner Smith.
Here.
Commissioner Nystrom.
Here.
Commissioner Schoonmaker.
Here.
Commissioner Anders.
Here.
Commissioner Bustler.
Here.
Commissioner Beeler.
Here.
Commissioner Daly.
Here.
Commissioner Jay.
Here.
Commissioner Biggs.
Present.
All members are present.
All right. Thank you, Madam Clerk.
You're welcome.
Commissioner Smith, would you begin tonight's meeting with the devotional?
Thank you, Mr. Chairman. Fellow commissioners, we live in troubled and difficult times. We are constantly bombarded by doom and gloom 24 hours a day. And it would be easy to think that nothing good is happening in the world today. But there is good happening all around us. Acts of humanity, people helping people, God's work being done to help those in need. I think we need to focus more on the good that is happening. And I encourage everyone to seek the comfort, peace, and hope that can be found in the Lord God Almighty. Please bow your head and join me in a short prayer. Heavenly Father, we ask for your guidance and wisdom to help make correct decisions for the citizens of Knox County. Lord, we ask for your blessing of protection for Knox County, our state, our nation, and your world. Lord, we pray that your will be done. Amen.
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 Thank you so much, Commissioner Smith. Tonight, we also have Commissioner Daly is going to be leading us in the Pledge of Allegiance. Before Commissioner Daly leads us in the pledge, I do want to give him a little bit of extra time to tell a little bit about the history of the flag that he's got for us. Go ahead, Commissioner Daly.
Thank you, Mr. Chairman. Let me get this. This flag was flown on September the 11th, 2012 over Afghanistan by our Air National Guard 134th Refueling Wing. And my nephew, Zachary Daly, is a boomer on this plane right here. And I am so proud of him and so proud of our military and our first responders. And this flag is special to me because it did fly over Afghanistan in 2012. So if you would, everyone, if you want to stand, I'll say the Pledge of Allegiance. I pledge allegiance
to the flag
of the United States of America and to the republic
for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. What we're going to do, I know we may have some folks who are tuning in tonight's meeting. It might be your first time ever watching a county commission meeting. Who knows, you might be having an early dinner tonight and you're flipping through CTV community television and you came across this. But I do want to sort of lay out the land of how our commission meetings work and where we are in our monthly cycle of meetings. Every month we have two county commission meetings. Usually on the third Monday of the month, we have what's considered a county commission workshop. And on the fourth Monday of the month, we have the formal Knox County Board of Commissioners meeting, which is what this meeting is right here tonight. Last week during our work session, we did what I would describe as a first pass through the agenda, where we discussed many of these items. We divided some items that were frankly dealt with and discussed last week, and some items were carried forward for to be worked on tonight. We also identified a number of items that were placed on the consent agenda for tonight. So what that means is there's going to be a couple of times in tonight's meeting where we will vote on a slate of items that we already have discussed and vote and approve all of them with one vote. And you'll hear the county clerk reading them into the record. And it seems, if you've never seen it before, it sometimes can be hard to understand what's happening. But what that means is items that were previously discussed, put on our consent agenda, will all be voted at in one time. So that's kind of how things are going. Then later in this evening, after the main Board of Commissioners meeting, At approximately 7 o'clock, we'll proceed to go into our zoning meeting. So if you're watching this meeting right now because you've got an interest in a zoning or land use issue, that's going to be a separate leg of the meeting that will start at 7 o'clock. If you're someone that's got an agenda item on the zoning, that's actually a separate Zoom meeting that you'll need to log into, and our IT department will assess that. And then all to all my fellow commissioners, as you know, our plan will be that we will log out of this meeting, then log back into to start the zoning part of the meeting. So hope that's clear. The IT department, as they've all been very helpful to help make this happen. We're now at the part of the meeting where we'll set our agenda. I've got couple of items that I want to clarify and add here at the top of the agenda. Mayor Jacobs is going to kind of provide an update. I know that y'all probably saw the announcement and have read about the businesses that are going to be reopening. So I know Mayor Jacobs would like to talk to that. That's going to be on the top of the agenda. That's going to be followed by Sheriff Tom Spangler with a similar update. So those are two ads that we will jump into first. Then we'll move into the more formal agenda. And just if you're writing this down, another item that we need to formally add, which will then go on consent, is item 35. The items that are going to be deferred are going to be items 16, 31, 33, 34, 36, 37, 40. Item 52 will be withdrawn. And the non-consent items for tonight's meeting are going to be items 1, 2, 3, 4, 38, 39, and all zoning items. I also want to, here at the beginning of the meeting, be clear and state for the record that we are meeting electronically via Zoom streaming pursuant to Tennessee Governor Bill Lee's Executive Order number 16. So that is the reason why we are meeting in this particular format. So are there any changes to the agenda, pulls, things? The chair recognizes Commissioner Smith.
Thank you, Mr. Chair. I may have missed it, but there was an item to be added about some hand sanitizers from Smoky Mountain Moonshine.
You're right, and I'm not sure that's on here. Yeah, we do need, I thought I'd forward that on, but we do need to add the agenda item to accept the delivery of the Smoky Mountain Moon, the hand sanitizers. Let's see if we can get that formally stated. Thank you for catching that, because I got a call on it and I may have even gotten an email and somehow didn't get that on our agenda.
I think we did get an email on that.
Yeah. Drusilla, can you pull that item? Have you got a record of it?
I did send it by email to all the commissioners, and it's 904.
It's which item is it?
It'll be resolution 904. I can resend the email if you need me to.
Okay, and that one I'm looking through here.
It
Is that
won't be
one on the agenda that was put up to agenda quick?
No, because it has to be formally added, and it was after.
Okay, so yeah, so we do need to also add that item. So that will be an additional add. Thank you, Commissioner Smith. Is there any others?
Mr. Chairman,
Oh, yeah, Commissioner Scott. Yeah, Randy, you've still got your hand up or your light on, so to speak. Is that okay? Okay, Commissioner Smith. All right. Okay, now Commissioner Schoonmaker, you're recognized.
yes, we need to formally add number 39 for this evening, a discussion item about County Government Month.
You're right. It's in print, but yes, we do need to add that one as well. So that was 39. That was the discussion item that was added at the work session last week. It is on your agenda quick. All right. Are there any other items? Okay. Seeing none. Commissioner Schoonmaker, are you good? I see your hand still up. All right. Thank you. Is there a motion for setting tonight's agenda?
Commissioner Smith, a motion to approve agenda.
Second.
And a second, so we have Commissioner Smith with the motion, the second from Commissioner Gill. Madam Clerk, would you please have a roll call vote to set tonight's agenda?
Commissioner Carringer,
Present.
Commissioner Carringer, you voting aye? This is on the motion to amend the
Yes.
agenda. Okay, to accept the amendments. Commissioner Smith,
Yes.
Commissioner Smith votes aye. Commissioner Nystrom,
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker,
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders,
Aye.
Commissioner Anders votes aye. Commissioner Bustler,
Aye.
Commissioner Bustler votes aye. Commissioner Beeler,
Aye.
Commissioner Beeler votes aye. Commissioner Daly,
Aye.
Commissioner Daly votes aye. Commissioner J,
Aye.
Commissioner J votes aye. Commissioner Biggs,
Aye.
Commissioner Biggs votes aye. Commissioner Gill,
Yes.
all members present. Commissioner Gill votes aye. All members present voting aye.
Okay, thank you. It passes. Okay, the first item on tonight's agenda, the chair recognizes Mayor Glenn Jacobs. If you'd like to provide an update, please.
Thank you, Chairman, and thank you, Commission. We've been very fortunate here in Knox County and East Tennessee. We've been able to thus far avoid the brunt of COVID-19, and our numbers have been relatively stable. Two things I think that since we talked last Monday, one is the health department is continuing to do testing and expanding that as much as they can. This past weekend, thanks to the city of Knoxville, we had a testing event at the Coliseum where they did over 500 tests, and they will be doing drive-through testing at Engineering Public Works, I believe, on Tuesday, Wednesday, and Thursday of this week. Getting test kits is still a challenge because there's such demand nationwide. So that's one of the restricting factors in what they're trying to do. But they are expanding as much as they can. They're doing a very good job. And Dr. Buchanan and her team have done a fantastic job throughout this entire process. And again, I'd like to thank IT for help in setting up the drive-through testing, as well as Engineering Public Works for facilitating that. The other news, of course, is today we had a press conference where we announced the plan from the City-County Joint Task Force for a phased reopening of businesses in Knox County. That will go into effect on May 1st. The governor's order expires on April 30th. He had changed some things, as you all probably know, with restaurants opening today and some other things. So Dr. Buchanan had to reinstate her order, but on May 1st, we will see our restaurants open at 50% capacity with some other restrictions, as well as other businesses. There are benchmarks within the document as to how to proceed after that into phase 2 and to phase 3, each of course having less restrictions than the previous phase. And we cannot reiterate enough that I think that a large part of the reason we've been successful here in East Tennessee in mitigating the spread of COVID-19 is because people have accepted personal responsibility in their actions and to keep their communities safe. And that doesn't go away. COVID-19 is still going to be with us for some time, so we all have to keep that in mind. And this unfortunately doesn't mean that things are returning back to normal probably anytime soon, but we are making strides in that direction. And appreciate the health department, the city of Knoxville, and the Joint Task Force, and all the businesses as well that had input into developing this plan.
All right. Thank you, Mayor Jacobs. Does anyone have any follow-up questions for Mayor Jacobs? Let me see if I have a show of hands.
Gill.
Yep. Commissioner Gill, do you have a question? I'm sorry, Commissioner Gill, if you could turn on your microphone, please.
Yes, thank you, Mr. Chairman. I wanted to know if restaurants that are opening are going to have an opportunity to have a certification or a certificate saying that they have met some of the guidelines that the health department has set about, and how is that going to take place? Thank you.
The health department is creating teams that businesses can call and will help them implement and adhere to the guidelines. And yes, there is a process. I'm not exactly sure how that will work. That would be a question for Dr. Buchanan. But there is a process to where they can get a certification showing that they are adhering to the guidelines. And that's for all businesses.
Okay. All right. Thank you, Commissioner Gill. Did you have a follow-up to that? All right, Commissioner Gill, if you could tap your space bar or turn on your mic.
Thank you, Mr. Chairman. Yes,
Yeah.
my follow-up question is, does the health department have the staffing capacity to issue certifications, or is it going to be staggered by business, whether it's a restaurant, whether it's a salon, whether it's any other intimate business that deals directly with the public? That's what I wanted to know.
Right, yeah. With the staffing, of course, that is going to be challenges because like all of our departments, they don't have unlimited resources. And again, those specific questions you have to direct towards Dr. Buchanan. I know that they'll do the best they can. And one of the unique aspects of this plan is that they do have these teams and this potential certification, which was something that we came up with here in Knox County. I've passed it on to the governor's office, but we're really happy that came out of the Joint Task Force because at this point it's unique to Knox County.
All right, thank you, Commissioner Gill. The chair next recognizes Commissioner Daly, followed by Commissioner Jay after that.
Thank you, Mr. Chairman. Mr. Mayor, can you update a little bit on the medical? I personally have missed 3 very important medical appointments, and I know where hospitals are at less than 50% capacity. So do you have any update on when our medical, eye doctor, specialist, everybody will be open?
The Commissioner, that's a great question. My daughter is in the critical care field, and she actually flew up to New Jersey yesterday to work in a COVID unit at a hospital because there is so little work here currently. Last count, our hospitals here in Knox County, we're a little over 50% occupied. We look at ICU beds. Those at this point, again, those are fine at this point and adequate for anything that we anticipate. Ventilators, the ventilator counts, those are really fluid because ventilators can be moved wherever they need to across the state of Tennessee. I believe, and this has become an issue. We've had some outpatient surgery centers reach out to us because of the current prohibition on elective surgeries by the governor's office, of course, and dental procedures as well. They just can't do anything. I believe that the governor is going to lift the prohibition on some elective surgeries on Friday, but that's and this is what we're following. That's going to be under the state guidelines.
Mr. Chairman, I think I seen Dr. Buchanan. Is she there?
Commissioner, I'm not sure if Dr. B is there. I mean, that she's probably with the mayor if you wanted to weigh in on anything.
No, can you not hear me? I'm here.
Okay.
Yeah, sorry, I tried to answer, had some technical difficulties. For some reason, Zoom wants to call me Peggy. And Zach didn't recognize Peggy. Me either. So anyway, just to answer your questions, Mr. Gill. We already regulate all the restaurants and food establishments, so we have a process for regulating them. We are partnering with the city and county codes and other people to help us regulate the other businesses. And that's worked well so far. We've been doing that with them this whole time. So we anticipate that to continue to work well. We're putting together guidance and have given out guidance this whole time to all the businesses that are involved in changing their process. So we feel pretty comfortable with that. It's going to be busy, but our staff is up to the task.
Okay, Dr. Buchanan, it sounds like that follow-up was based on Commissioner Gill's original question as well as Commissioner Daly's. I'm going to look to both Commissioner Daly and Gill to see if that's got your question answered. Okay. Next, the chair recognizes Commissioner Jay, then Commissioner Smith after Jay. Commissioner Jay, recognized.
Thank you, Mr. Chair. This is a follow-up for Dr. Buchanan on the original question regarding certifications. I just want to make sure we're clear. Restaurants that are reopening will need to have a certificate that says they're following the rules, and that's going to be issued by Friday?
Actually, no, they won't. There's there's some confusion on that. There's no certificate to say they're going to be following the rules. We've communicated with them like we normally do about changes. And then we'll be doing our normal spot checks that we do to inspect. And those resumed, I think those resumed this week, actually, in anticipation of restaurants opening across the state. We were asked to resume our inspections. So there will be technically no certificate for that. A re-permitting process is not in place to allow them to operate.
Okay, and just following up on Commissioner Daly's question and conversation with the mayor about medical places that I know there's several constituents have called me that have places that were deemed non-essential because they were either elective processes or are those in this guideline that was released today? I'm having a hard time finding the page that talks about healthcare professionals.
It's not in there. Separate guidance that's still under the governor's order. He's changing that. He didn't change the date of that order, and that'll be updated by the governor. So it's kind of a combination of things. The reopening plan is primarily focused on businesses, not on medical. They have their own governing agencies and guidance that are out there that comes from the state. So most of what we're dealing with in the plan is related to non-medical guidance. Medical guidance is coming from Tennessee Hospital Association, Center for Medicare and Medicaid, as well as the state of Tennessee. So that guidance is coming down that way and through other professional organizations.
And do you have any knowledge of when that guidance will be given? And I mean, if this order is through the 1st and here we are on Monday, or has they announced any kind of, we'll give you more guidance on Wednesday or Friday or next week?
All professional organizations have guidance on their websites. We're putting together that resource for our local American College of Surgeons, plastic surgeons, dermatologists, you name it. They all have lots of guidance out there, as well as the CDC has guidance for how to safely see patients. So I'm not sure we're going to reproduce that guidance because it's already out there and it's done by professional agencies or professional organizations. So we're trying to put that together. We've asked the Knoxville Academy of Medicine to act as a resource for providers to be able to provide that service. But again, the governor may put some guidance out for medical providers. I'm not exactly sure what he's going to put out. He said some things today. One of them was gyms, but I don't remember the others.
Okay, thank you very much.
Okay, thanks, Commissioner Jay. Commissioner Smith.
Thank you, Mr. Chair. I was going to weigh in, and then Dr. Buchanan's already clarified this to Carson Daly's question. Medical practices are regulated and licensed by the state, and they'll be issuing all the guidance on that. I think I saw somewhere the other day, I don't know where you get information from these days. Sometimes you get too much information, but a four-phased approach to reopening. And in there, I believe there was a guidance on medical practices.
All right, very good. Okay, are there, Commissioner Smith, your light's still on, but are there any other follow-up questions addressed to either Mayor Jacobs or Dr. Buchanan?
Mr. Chairman, I have one.
Yes, Commissioner Gill. Oh, Commissioner Gill, please push your space bar down again, please.
Thank you, Mr. Chairman. My follow-up question is for Dr. Buchanan. But first of all, I want to say I really appreciate the number of county residents that came out Saturday, which served more than 500 people to take the COVID-19 test in the process. That was exemplary from our staff, especially our IT department and all of the health department professionals that were present on Saturday to efficiently issue that test to the public. So I just need to, first of all, acknowledge that. And second, I need just a brief amount of information as it relates to our process for any future testing that will come forth for the community, or have we reached the end of what we're going to be doing regarding testing in Knox County?
Dr. Buchanan, that's you.
Sure. Yeah. So most providers in Knox County are testing, and we encourage folks to reach out to their doctor. Walk-in clinics are also testing. We know that. So the private sector is doing testing. Obviously, if somebody goes to the hospital and needs emergency care, they're able to test as well. As far as what the health department is doing, we are testing right now. Our schedules are going to be testing 3 days a week during the week in a drive-through model that helps preserve PPE, because we're going to have to change out everything. We only have to change our gloves in between patients. It keeps us safe and keeps the patient safe. In that model, we're able, and it's an appointment model, and it helps us a little bit with scheduling. And in that model, we're able to test 100 to 150 people a day, and we're tweaking that every day to see what we can max out and not run out of our supplies. As the mayor mentioned, supplies continue to be a challenge for us, and we continue to look for options. And in addition to that, what my staff wants to do is map, where the zip codes that people live in where we have tested. So, and then look at the map of cases, and look at the map of where testing has happened, and target our testing in areas where there's less access to testing. So using some data to decide where we're going to do testing if we do another surge type event. In addition to that, the state is asking public health possibly to do some more testing in our nursing homes. As you know, nursing home residents are at very high risk for complications. And they, in other parts of the state, they've had some pretty significant outbreaks. And we may be doing some focus testing in nursing homes as well. But again, trying to use some data so that we make the best use of our resources, go to areas where we haven't seen a lot of folks tested, which is why we decided to do 37915. We looked at our map of where we tested people, and we hadn't tested anybody who lived there, even though honestly, we're not that far from 37915. We still hadn't tested anybody there. And so we went there and had a successful event. So we're going to do the same kind of thing in thinking about future testing. We won't be doing any testing this weekend at this time. Just going to take a step back and look at some data and make some data-driven decisions about where to test.
Commissioner Gill, would you, I'm sorry, we can't hear you.
Listen, I got, yes, I will just make sure that's done. Thank you, Dr. Buchanan. My follow-up question is, could someone speak to the reactions from the public regarding the decision to open? What businesses, what are some of their comments, and has it been positive, or has it been tepid? Has it been people are going to wait? Could someone speak to the reaction regarding that? Thank you.
Mayor Jacobs or Dr. B, you may want to handle that one.
I mean, the reaction's been mixed, and it depends on who you talk to. Some people are ready to go, and other people are, as you said, tepid. So, I mean, this is going to be a process. There's no doubt about that. And again, it just is almost what quarter or what sector of our community that you talk with have different concerns. So it's hard to say what the overall reaction has been, because it's varied very much.
And I would echo that from the reports I get from my staff. Some people, it's just a mixed bag. Some people have lots of questions. Some people are just ready to go. And some people are like, yeah, I'm not so sure. So, I think it's up to individuals to make that decision about individual business owners and individuals themselves about, do they go out, do they reopen? But it's also, our guidelines are written to really help create a safe environment for people to go. If business owners and the public will both follow the guidelines, I believe we can maximize safety because they're based on how COVID-19 is transmitted, and that therefore based on the evidence of what we know protects people and prevents disease. So I think business owners are going to be responsible, the ones who decide to open. The ones who wait might just wait and see how it goes for everybody else.
All right. Thank you, Dr. Buchanan. Chair recognizes Commissioner Biggs, and then we'll go to Commissioner Jay, then Smith.
Thank you, Mr. Chairman. My question is actually for Dr. Buchanan. So in all of this, one of the questions that I've been asked by multiple constituents is where to go to for information. Where is the number threshold to where we start scaling back? Where, phase one, we just kind of, it's obviously a gray area, something we've never been dealing with right now. But they want an opportunity to look at information. What would be best for us as commissioners to give them? Is it the health department's website, the CDC? Is it the state's website? What would you prefer for us to do? Because I've gotten a lot of positive feedback off of Commissioner Jay. He put up a post on Facebook, kind of like a hot zone map of the zip codes, and people really seem to like that demographic of, being able to visually see something. Just kind of direct me what you think we should say.
So the first place I'd direct people is to our website, which is, I'm going to guess, where Commissioner Jay got the map of where cases are. It's not a hot zone map, it's a map of where cases are. And so that's the first place I'd look. That's where most of the data is. And, we didn't just make this decision because we felt like doing it. We made this decision because our case count has been pretty flat, not the count itself, but the increase in cases has been pretty flat for a few weeks. Our hospitals are well prepared. We've built up our capacity and tested our model, and we know it works. We've gotten more testing supplies, and more testing is being done throughout the community. So we saw some positive results from what we've been doing and felt like it was time to make the next step. We will use similar benchmarks. Those benchmarks are talked about in the plan. We're looking at testing, case increase, hospital capacity, our capacity to do contact tracing, and also deaths. We'll be looking at deaths as well. And so all of those things give us a picture of how things are going in Knox County and what's happening. And within the context of what it really looks like. Do we have a whole bunch of cases because we have an outbreak at a facility? That's one thing. Or do we just have a whole bunch of cases spread across the community? That's something very different. So it's not one number. That data will be available on our website. Knox County IT has been fabulous to work with, and changes and helps to change our website so that the public can have that information to be able to see how we're doing.
Can you just that website real quick, please?
It's a great question, Zach. I'll have to find it and give it to you because it's a COVID something. Sorry, I don't.
Yeah, there's a link to it just on the front page of knoxcounty.org, right dead in the center of the page.
Oh, thanks, Zach.
All right. Thank you. Good question, Commissioner Biggs. Do you have any follow-up? Are you good?
Yes, sir. I'm good. Thank you.
Okay. All right. Great. Next, Commissioner Jay, and then now Commissioner Smith has turned his light off. All right. So back to Commissioner Jay.
Thank you, Mr. Chairman. If I could just get some clarification from Dr. Buchanan, and I've had several constituents reach out that they're very confused on the group size parameters. They look at the guidelines and they look at, you can go to Lowe's, you can go to Costco, you can go to any number of places that people may be spaced apart, but collectively under one roof in one space, there definitely could be over 100 people. They look at guidelines for churches that say, yes, come in socially distanced, but again, in one space, well over 100 people can be there. But then you look at the sort of avoid or don't have any events that have more than 10 people. And it really, I mean, it knocks out, first off, it knocks out a huge industry, which is the event industry, which could be anywhere from caterers to tent suppliers to wedding venues to whatever. But even you couldn't even have a wedding outside, even if you social distance in a large group according to the guidelines. So I guess just some clarification on the group size, because the guidelines I know have to be set in a certain way to sort of put some real parameters around it. But it seems counterintuitive when there's a line out the door at Costco in the morning and you can't hold an event somewhere else and in even an outdoor space.
Well, I think that the difference comes in the purpose of the event. Waiting in line at Costco is not a social event usually. I don't think so. People aren't hugging and kissing and shaking hands. Where a wedding or a fundraiser or other things like that are much more of a social event. The reason we closed, we're not going to let people stand at the bar in a restaurant is that's meant for congregating. It's meant for coming together. I think we're going to have to pay attention to cases from places like churches. It's a slippery slope. I think it's a bit of a challenge with allowing churches to open, but we felt like that was something our community needed. We felt like the churches were willing to follow those guidelines. So again, part of it comes down to the purpose of the event. And most events held at event venues are around congregating and getting together and sharing. It's usually a buffet, and there's lots of sharing happening.
Well, could somebody hold an event and say, here, we're going to hold an event. It's going to maybe be a music event for the day, and we're going to do social distancing, and we're all going to sit 6 feet apart on the lawn and watch a concert. Why would that be any different than a church service or another type of event that is being allowed?
That's a great question. And, these guidelines are written based on CDC guidance and honestly, also for guidance from Johns Hopkins on recommendations for how to maintain social distancing and reduce risk in the community.
I think I'm okay. I understand it. I really think that we ought to look at all of the different similar types of events, that some are being allowed and some are not, because we still have a tremendous amount of businesses that are really incredibly limited. I get it. I understand it. But if we're going to do for one, we ought to match and do that for the other. And I think that there ought to be a way for people to sort of say, but could we do something that's similar? So I want to point that out, especially for the event industry, which is, more than ever it's going to be, by these guidelines, nobody should even remotely think about getting together for any kind of event whatsoever till August. And that goes from hurting to devastating in a lot of capacities of our business industry.
Yeah, these guidelines were not easy to write. We had to think about all that. And we're very aware of those challenges. But we're also very aware of the public health risk and the disease risk and the reality of COVID-19. So trying to balance all of that was a real challenge. We certainly are open to reconsidering, but we can't reconsider every guideline. We have to, at some point, just make decisions and move forward. And I'm compassionate. I'm understanding of the challenges. Again, the guidelines are very challenging to write because there's no playbook for this.
Thank you.
I get it. I've heard from a lot of folks as well, Commissioner Jay. I'm not seeing any other lights. So I think that should wrap up the questions for both Dr. Buchanan and Mayor Jacobs. I'm sorry, Commissioner Smith. Commissioner Smith, your light just came on. Your microphone is off.
Yes, thank you, Mr. Chair. Well, I just found the 4-phase document, and apparently it is some more Facebook internet fake news. Dr. Buchanan, do you know, has the state said when we'll be able to go see our primary care physician, when we'll be able to go see our urologist, when we'll be able to get back to seeing our are doctors that provide the daily health and screen us for diseases other than COVID-19 that we may have.
Honestly, the ability to go see your doctor never stopped. That was a decision made by your doctor, actually. It was only elective surgeries and like mammograms and stuff that got, and again, some of that was even a decision made by the provider. Primary care offices have been open and seeing patients. I don't know about the urologist, I don't know about the particular practice, but doctors have a lot of autonomy in what they decide to do or not to do, and they may have decided that they weren't going to do those things for lots of different reasons. But those practices have actually been open, but they may have been limiting their exposures and limiting their patients' exposures. I know my father sees a gerontologist. They were not seeing patients because of the age of their patients. So different practices made different choices. That was not an order from the governor, actually.
Thank you, Dr. B.
Sure.
All right. Thank you. Let's see, final question to Commissioner Biggs.
Thank you, Mr. Chairman. Yeah, a quick question, and I probably could guess what it'll be that we don't know because it's in that gray area like we were talking about earlier, but phase 3, July, August area, would that be when people could start looking? The reason I'm asking, because I've had a lot of questions about this, when we can start talking about graduating our seniors or graduation ceremony, or that would obviously be up to schools as well, but your input would definitely be needed for that one.
Well, that's a great question. I guess what I want to remind everybody is that phase 1 is at least 28 days, depending on all of those data points we talked about earlier. Phase 1 could last longer than 28 days. And then phase 2 will be the same way. We have to wait and see what disease rates, what is happening with disease rates and capacity and deaths and all of those things. So I don't really want to make any predictions on what the summer is going to look like because I just don't, we don't know how reopening is going to go. Reopening might be totally fine and we get a little blip in cases and we kind of go back to where we are now. We're just kind of the same number of new cases every day with very little variation. And that'd be great. If we did that and our hospitalization stayed low and our death rate stayed low and all of that kind of stuff, then we'd move on to phase 2. But if we skyrocket in cases and our hospital capacity gets wiped out, we won't be able to go on to phase 2 because we've moved too quickly. And I know everybody hates that uncertainty. Everybody wants me to be able to say, yeah, sure, we'll be able to move on to the next phase. But the reality is that it's very dependent on what our community chooses to do. And whether our community chooses to continue to observe the guidelines, and that's the business side and the public side, observe the guidelines that are as they're written based on how disease is transmitted. And they've been doing that, and I trust they're going to keep doing that. And I know Mayor Jacobs has said the same thing. We've been doing that. We trust that people are going to keep doing that. And you guys asked questions about regulation. We regulate all the restaurants actually. But we really approach it as a partnership, educate them and help them make the right choices to be able to serve their patrons safely.
All right. Thank you, Dr. Buchanan. And Chair recognizes Mayor Jacobs for another insight.
Yeah, thank you, Chairman. I'm actually in the chat box. I'm typing the website address that the county has set up dedicated for the health department and COVID-19 information and statistics. And also, any plan or anytime the government comes up with a plan, there's going to be issues with it because generally they're one-size-fits-all policies. But I will tell you that the Joint Task Force did work hard to be flexible. There was a lot of input from different businesses. In fact, businesses in some cases were the ones that actually, offered the guidance because it's stuff that they know that they can do and could be effective at. So as much as possible, Dr. Buchanan and the Joint Task Force did try to be as business friendly as possible through all of this. It's not going to be perfect. It never is, but they did make a tremendous effort to do that.
All right. Thank you, Mayor Jacobs. Okay, moving on to our agenda, the chair now recognizes Sheriff Tom Spangler. Sheriff Spangler.
Thank you, Mr. Chairman. Thank you, Commission, for giving me a few minutes just to give you an update on our what we've been doing with the Knox County Sheriff's Office as far as our patrol answering calls and with our corrections division. So first off, I want to say very much how much I appreciate the men and women of the Knox County Sheriff's Office for the job they've been doing during this pandemic and making sure that not only we continue the services that I think that our citizens out here demand and deserve. And I want to make sure that that I commend them for the job that they're doing, being out there on the front lines, not only the men and women that are out there on patrol, but also our men and women working within our corrections facility. With that being said, just to give you a few updates, and before I move on, let me also say, I want to say thank you to Dr. Buchanan. She has been nothing but right there on the spot with us. Anytime we call, she's calling us back. She's answering. Her and her staff have been phenomenal with our corrections division and making sure that we've gotten everything that we're supposed to and that we're doing what they recommend. And also we're doing things that that even I think may have surprised a lot of other people on how well they've been doing things. So with that, Dr. Buchanan, thank you. Since March 15, we have, I shouldn't say we, our courts and commissioners or judicial commissioners have released 537 inmates out of our corrections facility. We have never been at a point to where we are today. Today, our facility has 637, and I'm talking about our Roger D. Wilson detention facility. We have 637 people in that facility, which is down 400 inmates. That dispels some of the fake news that is out there that we're not letting, or that we're holding inmates and they're not having an opportunity to either be released on their own recognizances or whatever it may be. We've got some so-called people out there that think they know what's going on within our facility. And this is why I want to get in front of you all to let you know what really is going on. Not only that, but right now, currently, we have 1,660 individuals that are on our pretrial release program. That's active people that are being watched right now. So we've got a lot going on, just not only within the correction side, but also with our pretrial. To give you a little bit of insight, when somebody is arrested and they're brought into our facility, there's a process that they go through, and that process is to make sure that they are tested to make, or when I say tested, that they are evaluated and also isolated for 14 days if they're within our facility for that long, to make sure that if they do have the virus, that we're following the CDC and the recommendation of Dr. Buchanan's office. So we want to make sure that not only our employees are taken care of, but we're also taking care of those inmates that come within our facility. As of today, we have had 0 inmates with COVID-19. I knock on wood because I probably say that and I may end up ruining that as we go. But I want to make sure that because of the assistance from Dr. Buchanan's office and the resilience of our employees of going through everything that they should, and our pandemic process that we have within our facility, that things are going very well. And I'm very thankful for that. And I would be remiss if I didn't say that I appreciate the job that they do. Some of the things that I want to dispel that are going on out there, there are people out here that think that they know what's going on and they want to complain about what's going on within our facility. And some of the things is that, as I mentioned to you earlier about our facility at the Roger D. Wilson, that facility, when it was originally built, had 633 beds. Today we have 637 people at that facility. And what that means is we have 2 or 3 of our, that we have 2 buildings out there, 2 pods that are empty. So we have the capability, if we do have something happen, we have the capability of isolating people to where we need to have them. And so you as commissioners, I think would be very proud of the men and women, the way that they have worked and make sure that we're taking care of our citizens and those who are out here committing crimes that probably they shouldn't be doing. But some of the misinformation that has gotten out, there's an allegation that the jail is overcrowded. And as I mentioned to you, it is not. Another allegation is out there that 2 or 3 cells, allegation that there are 2 or 3 cells out there that are overcrowded. And just so you know, all of our cells right now are single occupancy, which is something that hasn't happened in many, many years. We've heard that there's no hand sanitizer that's out there. That's also a false rumor that's going around. And to give you an idea of how much cleaning that has been going on within our facility out there at Roger D. Wilson and our facility here at the City County building and our work release center, they put in over 2,500 hours of cleaning that's been logged. So every time somebody's moving, there's cleaning going on. And so that's something that we make sure that we continue to do. The allegation that there's a shortage of medical staff at our Roger D. Wilson facility, it kind of perturbs me to the fact to know that people think that that those things are going on. And I guess it's because somebody makes that allegation that has to make it true. But within that facility, I think everyone knows that we have a contracted physician out there, also a psychologist, a part-time dentist and full-time dentist assistant, full-time x-ray tech, a pharmacy supervisor, medical or 9 medical techs and 13 LPNs and 7 RNs. We have a miniature emergency room within that facility. So it's, I think to say that we're not taking care of inmates is, well, I think you know where I'm going with that. There's an allegation Knox County Jail in any way can be compared to jails in Iran or China. That's absurd, as absurd on its face as can be. And, you know, for people to print things like that, to think that that's what's going on here, yeah, I get a little aggravated about it because, you know, the men and women out there are working very hard. And I think it's very important that we stand up for them. We screen not only, as I said, with our inmates, we're also screening our employees, our vendors, any official vendors that come into the lobby and the loading dock. So it's not just something that's haphazard. We're taking very serious of what we're to do. All of our screening, all the arrestees in the Sally Port, so it doesn't get into the facility before we ever do anything at all. There's many other things that go on, and I'm not going to bore you with it, but I wanted to make sure that also some of the things that are going on is that we now have video arraignments with our courts. So that's taken up a lot of time to keep us from transporting our inmates back and forth. So hopefully that's something that will continue on. Obviously, it's going to save Knox County money as far as transportation, and hopefully we'll look for that to happen a little bit more down the road. As I said, I wanted to make sure that that you all know at least what we're doing out here. We have put extra men and women out on the streets, making sure that we stay in our subdivisions. Those people who are working in our schools, we've got them out answering calls and also making sure that we saturate Knox County with visibility and letting people know that we're out there, not to be enforcing anything as far as the COVID-19, but if they need something, we're there. You know, and those men and women that are out there on patrol, that's what they're doing. We have been on, let me take that back. They have been on the front line and making sure that when somebody calls, we go there and we're not going to back away because of the virus. We are taking our precautions. And I think the men and women have done a excellent job of that. So with that being said, again, let me say thank you to those men and women of the Knox County Sheriff's Office. I appreciate their hard work, and Dr. Buchanan and her staff for working with us very diligently and side by side. So Dr. Buchanan, again, thank you.
All right, thank you. I'd also like to recognize Dr. Buchanan to make a follow-up after Sheriff Spangler.
Sure, thanks, Commissioner. yeah, I want to commend Sheriff Spangler's staff on the job that they're doing and to ensure that their staff are safe, the inmates are safe out at the detention facility. They work really closely with my staff to ensure that, and I feel very comfortable with the protocols they have and the way they're handling all of that. So, and they've also been very responsive when we've had a few issues with folks who didn't want to follow guidelines and stay in isolation.
Okay, thank you, Dr. Buchanan. Does anybody else have a follow-up for Sheriff Spangler? Okay, all right, seeing none, we will now move forward with the rest of our agenda. So,
I think Vice Chair Carringer had a question. I saw her raise her hand.
okay, I'm sorry, I was looking at the participant box to see if anybody clicked on that little blue thing there. So go ahead, Commissioner Carringer.
Thank you, Chairman. Sorry about that. Mine's somehow not popping up. I just wanted to make a couple of comments. One, wanted to thank our health department and the whole staff for what they've been doing. And also kind of a couple of questions that Commissioner Daly and Commissioner Smith brought up about physician offices and all. As far as I know, all of them that I know have been working the entire time, and a lot of them are doing the telemed. So you may check with your physicians to see if they're doing the telemed. But that is a big ongoing thing right now. And then the other thing was just to say thank you to all of the sheriff officers and our city officers, all those first line responders. Thank you all for being there and putting yourselves in harm's way. And I truly appreciate all of y'all doing, and to all of Knox County and the city. I think both mayors have worked very well with each other, and it really shows on the TV and in the paper. So thank you to all of you all. This is something new for all of us. None of us have ever experienced this in any field. So it's not over, and we're going to have to all remain a little more patient and do the best we can to support each other, so that we don't have nobody really knows why we've kind of been sort of flat in Knox County. And maybe it is because we have followed such great, the rules and trying to stay away. So anyway, I just want to thank everybody that's been involved in that day-to-day process. I know it's not been easy, but thank you all. Thank you. Made Knox County look very well in these times of difficult decision-making and circumstances.
All right, thank you. Thank you, Commissioner Carringer. All right, next, as we work through, I believe we've got drives and roads as our next agenda item, but I'll look to the clerk's office to call them out.
I'm sorry, Commissioner Nystrom, can we approve the minutes?
Oh, that's right.
Please,
So, yeah,
thank you.
I'm sorry, I'm jumping ahead. Forgive me. All right, we do need to get our minutes approved. So could the chair will entertain a motion for approval of the minutes.
So moved.
Okay, that was Commissioner Daly with the motion, and the second, just raise your hand, Commissioner Beeler. So first by Daly, second by Beeler. Madam Clerk, would you please call a roll call vote?
Commissioner Smith?
Yes.
Commissioner Smith votes aye. Commissioner Nystrom?
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker?
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders?
Aye.
Commissioner Anders votes aye. Commissioner Bustler?
Aye.
Commissioner Bustler votes aye. Commissioner Beeler?
Aye.
Commissioner Beeler votes aye. Commissioner Daly?
Aye.
Commissioner Daly votes aye. Commissioner J?
Aye.
Commissioner J votes aye. Commissioner Biggs?
Aye.
Commissioner Biggs votes aye. Commissioner Gill?
Yes.
Commissioner Gill votes aye. Commissioner Carringer? Commissioner Carringer,
Carringer?
are you muted?
Aye.
Commissioner Carringer votes aye. All members present voting aye.
Very good. The minutes passed. Madam Clerk, next item.
The next item is consideration of the acceptance of new county roads. Items A through F are all located in Creekside Manor, Unit 1, District W6. A is Creekside Manor Lane. B is Chirping Bird Lane. C is Turkey Crossing Lane. D is Dark Sky Lane. E, Misty Cloud Lane. F, Gusty Wind Lane. G and H are both located in Willow Park, Unit 1, District W6. G is Willow Park Lane. H is Hedge Rose Lane. And I through K are all located in Copeland Heights Subdivision, Phase 1, Unit 1, District E6. I is Cloudview Drive. J, Day Valley Road. And K, Skytop Lane.
All right, thank you, Madam Clerk. Could I have a motion for approval, please?
Motion to approve.
Second, Justin Biggs.
Okay, we have a motion from Commissioner Anders and a second from Commissioner Biggs. Madam Clerk, would you do a roll call, please?
Starting in District 4, Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner J.
Aye.
Commissioner J votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. All members present voting aye.
All right,
Commissioner Daly votes
thank you.
aye.
That item passes. Madam Clerk, next item on a reading.
It's consideration of a closure of a portion of the right-of-way on Cadillac Drive located at the corner of Cadillac Drive and DeVille Way, totaling 360 feet in length at request of Catherine Fuller. This is on first reading.
Motion to approve, Commissioner Anders.
All right, we have a motion from Commissioner Anders, and who was the second? All right, Commissioner Daly. Madam Clerk, would you please call the roll?
Starting in the 5th District, Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner J.
Aye.
Commissioner J votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. All members present voting aye.
Okay, it passes. And once again, much like I did at the work session, the commissioner is a fan of any time where you have Cadillac Drive and DeVille Way coming together. So, all right, moving on. Next item, line item transfers.
Motion to approve line item transfers.
Second.
All right, we have a motion for approval from Commissioner Schoonmaker with a second from Commissioner Anders. Madam Clerk, would you call the roll, please?
Starting in the 6th District, Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner J.
Aye.
Commissioner J votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. All members present voting aye.
Very good. It passes. And Madam Clerk, next item.
We have 141 notary applications.
Motion to approve.
Okay, we have a motion for approval from Commissioner Gill, and I think I saw the second from Commissioner Anders. Madam Clerk, please call the roll.
Starting in Commission District 7, Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner J.
Aye.
Commissioner J votes aye. Commissioner Biggs.
Yes.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. All members present voting aye.
All right. Thank you, Madam Clerk. Next item.
The next item is a spread of record. The Knox County Mayor's order appointing Jerry Price to the Board of Commissioners of the Knox-Chapman Utility District.
Thank you. And next item, educational consent calendar.
Okay. Item number 5 is Resolution 201. It's approving an agreement with the Blackboard Incorporated for a K-12 mass notification software system for a term of 3 years with the option to extend for an additional 2 years, 1 year at a time, for a possible total of 5 years and at a cost of $74,790 for year 1 and $74,550 per year for years 2 and 3. For 202 is a resolution approving a subscription agreement with Elevation Incorporated for the provision of the Elevation Education Platform for the term of May 1st, 2020 through April 30th, 2021 at a cost of $53,993.75. 203 is approving an agreement in the amount of $593,749 with the Porter Roofing Contractors Incorporated for roof upgrades at Austin East High School. 204 is approving an agreement with Studio 4 Design Incorporated for the design of roof upgrades at Fair Garden Family Center in the amount of $20,000 plus reimbursable expenses. 205 is approving an agreement with Merit Construction Incorporated for the Powell High School addition and renovation project in the amount of $2,758,552. 206 is approving a memorandum of understanding with the University of Tennessee for the 2020 Shakespeare's and Shades program at Vine Magnet Middle School and receipt of $14,531.78 designated for teacher stipends and student bus transportation. 207 is authorizing the acceptance of grant funds and donations for the Knox County Schools as shown on the attached list and in the total amount of $43,500.
Motion to approve, Mr. Chair.
All right. Thank you. We have a motion for approval from Commissioner Daly. Is there a second?
Second.
All right. Second from Commissioner Schoonmaker. Madam Clerk, would you please call roll?
Starting in District 8, Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner J.
Aye.
Commissioner J votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. All members present voting aye.
Okay. Thank you. It passes. Madam Clerk, next item, please, should be the general government consent calendar.
Yes. Resolution 110 is reappointing Jim Wright Jr. as a member and Leskinsky Emerson as an alternate member on the Knox County Sheriff's Office Merit System Council. 111 is reappointing Bill Keeler, Gene Lawson, and Jerome Salomon as members and reappointing Gina Oster and appointing A. Dean Lewis as alternates on the Knox County Board of Equalization. 112 is appointing Chris Howley, nominee of the City of Knoxville, mayor of an official or employee of the City of Knoxville, to the Knox County Air Pollution Control Board to complete the unexpired term of Jim Hagerman, who has retired from the City of Knoxville. 113 is appointing James Shemayet, MD, nominated by the Medical Society serving the county, Colonel Pat O'Brien, MD, nominated by the Medical Society serving the county, and Dr. Maria Hurt, nominated by the Nurses Association serving the county, and reappointing Diana Drake, Form D, nominated by the Pharmaceutical Society serving the county, and Jack Gotcher, Jr., DMD, PhD, nominated by the Dental Society serving the county, to the Knox County Board of Health. 401 is approving covenants for permanent maintenance of stormwater facilities and best management practices with trustees of the Danny Church of God for property located at 410 Danny School Road, CLT parcel number 057 KD 002. 402 is approving covenants for permanent maintenance of stormwater facilities and best management practices with Premise Land Company, LLC, for property located at 0 Cambridge Reserve Drive, CLT parcel number 051-018.03. 403 is approving covenants for permanent maintenance of stormwater facilities and best management practices with SRC Westland Cove, LLC, for property located at 9635 Westland Cove Way, CLT parcel number 144-02005. 404 is approving covenants for permanent maintenance of stormwater facilities and best management practices with Daily 2011 LLC for property located at 339 North Cedar Bluff Road, CLT parcel number 119-01863. 405 is approving covenants for permanent maintenance of stormwater facilities and best management practices with Waterstone Partners LLC for property located at 2411 Wave Rock Way, CLT parcel number 104-08404. 406 is approving budget supplement agreement number 2 in the amount of $136,100 with CDM Smith for additional scope of services for the Canton Hollow Road Improvements Project. 407 is approving amendment number 2 to the agreement with Kimberly Horn and Associates Incorporated in the amount of $48,500 for the Knox County ATMS Phase 1 project, which amount will be reimbursed to Knox County through a TDOT grant. 408 is authorizing the submission of an application for the Tennessee Department of Transportation TDOT Litter Grant Program for fiscal year 2021 through 2020. For fiscal year 2020 through 2021, and if said application is approved, authorizing Knox County to enter into a grant contract for the acceptance of the grant award in an amount up to $168,600. No local match required. 501 is number 1, approving the 2020 through 2024 Knox County Consolidated Plan, including analysis of impediments to fair housing and citizen participation plan, establishing a unified coordinated vision for community development actions for the upcoming 5 years. 2, approving Knox County's 2020 annual action plan to identify activities Knox County will undertake during the program year beginning July 1st, 2020 and ending June 30th, 2021, using federal funds granted to Knox County by the U.S. Department of Housing and Urban Development, HUD, to address priority needs in housing and the community in furtherance of the Community Development Block Grant, CDBG, and Home Investments Partnerships, home programs. And number 3, authorizing the acceptance of federal funds in an amount up to $1,207,100 for the CDBG program and $430,441 for the home program for the period beginning July 1st, 2020 and ending June 30th, 2021. 601 is approving Amendment 1 to a grant contract with the Tennessee Department of Health for the provision of evidence-based home visitation services, which amendment increases the maximum liability of the state under the contract by $189,200 and extends the term of the contract to expire September 30th, 2020. No local match required. 602 is approving a cooperative agreement for the acceptance of funding from the U.S. Environmental Protection Agency in the amount of $130,000 for Knox County Air Quality Management's ongoing collection of data on the ambient air concentrations of fine particulate matter. 603 is approving a contract with the Tennessee Department of Health for the provision of arbovirus testing of mosquito samples for the period beginning March 1st, 2020 and ending February 28th, 2021. 604 is approving a contract with the Tennessee Department of Agriculture for the provision of assisting in conducting retail food store inspections under the Tennessee Retail Food Safety Act in an amount not to exceed $318,604 for the period beginning July 1st, 2020 and ending June 30th, 2022. 701 is approving a permanent access and utility easement agreement for the West Knox Utility District of Knox County, Tennessee to obtain permanent utility and access easements and temporary construction easements on property known as Plum Creek Park with Knox County to receive compensation in the amount of $7,221 for granting said easements. 801 is approving a professional services contract with Ernst & Young LLP for the provision of energy program management support services related to COVID-19. And 903 is approving a grant contract in an amount not to exceed $950,000 with the State of Tennessee Department of State Division of Elections for the provision of acquiring voting systems. No local match required.
Motion to approve, Mr. Chairman.
Aaron's second.
You're muted, Mr. Chairman.
We all do it every now and then. So the motion was from Commissioner Dalen, with the second from Commissioner Carringer. All right, Madam Clerk, would you please call the roll?
Starting in the 9th Commission District, Commissioner Daly.
Aye.
Commissioner Daly votes aye. Commissioner Jay.
Aye.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Aye.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. All members present voting aye.
All right, thank you. I'm sure no one wishes to change their vote. So we've got that passed. All right, Madam Clerk, next item.
The next item is Resolution 904, which has been added to the agenda. It's the resolution authorizing the acceptance of a donation of 10 5-gallon buckets of hand sanitizer from Old Smoky Distillery.
Could I have a motion for approval?
So moved.
All right, motion for approval from Commissioner Bustler with a second from Commissioner Anders. Madam Clerk, please call a roll.
Starting in the 10th District, Commissioner Jay.
Yes.
Commissioner Jay votes aye. Commissioner Biggs.
Aye.
Commissioner Biggs votes aye. Commissioner Gill.
Yes.
Commissioner Gill votes aye. Commissioner Carringer.
Aye.
Commissioner Carringer votes aye. Commissioner Smith.
Yes.
Commissioner Smith votes aye. Commissioner Nystrom.
Aye.
Commissioner Nystrom votes aye. Commissioner Schoonmaker.
Aye.
Commissioner Schoonmaker votes aye. Commissioner Anders.
Aye.
Commissioner Anders votes aye. Commissioner Bustler.
Aye.
Commissioner Bustler votes aye. Commissioner Beeler.
Aye.
Commissioner Beeler votes aye. Commissioner Daly.
Aye.
Commissioner Daly votes aye. All members present voting aye.
Okay, before I announce the vote, Commissioner Biggs, you'd raise your hand.
Yeah, Chairman, and if not, then that's fine. I think it'd be really nice if we could do maybe like a proclamation for them since they donated that during this time. I think that'd be really nice of us if we could do that. If not, I understand.
Well, I know we'll put that, hopefully as we try to get to the other side of this, there'll be an opportunity also to honor a lot of folks like that. But I'll have Drusilla kind of put that on the list and we'll work through that because I think it's awesome. It's very helpful. So I agree with you, Commissioner Biggs. All right, everyone voted in favor of this. This item passes. Okay, Madam Clerk, next item. Ms. Ellis.
The next item is number 38. Discussion item regarding problems with TDS and Comcast providing service to customers.
All right, thank you. This was brought to our attention by Commissioner Bustler. So Commissioner Bustler, Chair recognizes you to open this discussion.
Thank you, Mr. Chair.
we always have a problem where it's either like 9/11 or we have flooding comes in, some things pop up that maybe we should have handled before the situation brings it to light to us. We've been talking about getting service throughout the county for internet service and things of that sort. We've had a problem with a couple of these companies that are unable to get it to a customer, these customers have the internet service all the way around them. Say like Comcast is on all four sides of this one customer. And I know they're a little bit farther off the road, but there is a pole that was close to this one customer that was within 150 feet of this customer. But under their guidelines, they had to go from the road 780 something feet to get them services, which costs about $3,000 for them to run that for that customer. But there's a pole right, again, 150 feet that's in this next subdivision that they could have, piggybacked off of. There's some instances for TVS. And the runaround that I got from these companies for these different companies, now this is one example, was unbelievable. When I talked to them in Nashville, it was, first of all, they sent me an email back, talked about that they had to install 4 poles for this one customer. Then I go out and take a look at it and see where these things are at and say, why can't you do this on the poles that are already stuck up there that the customer installed? And then they said, we were sorry about that, Mr. Bustler. We meant to say piles, P-I-L-E-S. I don't know what that is. They couldn't explain to me what that is. If we're going to give franchises in the county to where we can get internet to people like that, we ought to hold them accountable to get it to everybody if they got service close to these people. The other thing that we have too is right above us in Campbell County, we had a thing called K-12, which was a virtual school like what we're doing right now. With schools, what we're doing right now, we could have had school continue on if we had that service in Knox County, but we've kind of let that kind of slide. So let's look at this in the future. Let's look at K-12 to where we can have continually schools through some of these internet services like K-12 and get with the people in Campbell County, how they do it for the whole state of Tennessee out of Campbell County. Make sure that the people, when they need internet service, that they can get internet service without being charged an arm and a leg. And there's more examples than just that one. But once this slows down a little bit and we get back together, we need to have some people look into how we can get this service throughout our county that will also help our schools when they're out in sickness, that we can continue schooling on. And K-12 is a good example of what we can do, just like what we're doing under Zoom here.
Okay.
And that's what I wanted to bring up. I don't need, anything to be discussed about it. We just need to have a committee to set up and say, okay, how can we do this from this point on out? If we ever run into this situation again, how can we take care of schools? And the last thing I want to say, and this is kind of to Mr. Smith, I asked him a question about the hand sanitizer, and he could not answer me where it was internal or external. So I wanted to put him online for that. So anyway, thank you all for listening to me, but we do need to take care of these problems where we have continuing schools, even when they're out because of sickness. Thank you.
All right, thank you. Thank you so much, Commissioner Bustler. And I'll kind of make a clarifying statement. He's brought to us really 2 issues. One is internet access. Another is a different way to deliver educational stuff. I know at the start of this crisis, that was a major concern and will continue to be moving forward. I want to reckon I've got Commissioner Jay and Commissioner Biggs, whose lights are on. In order, it went Commissioner Jay's came on first and then Commissioner Biggs.
Thank you, Mr. Chairman. This seems to be a perfect topic for the Cable TV Committee. Is there, I think Commissioner Beeler, don't you chair that? I didn't know if there was any meeting or update or anything you had to add to that, or if that's something they'll meet maybe this summer or virtually.
Go ahead, Commissioner Beeler.
Thank you, Mr. Chairman. Yeah, I was thinking the same thing. I think it would be a perfect time to convene a meeting of the Cable TV Committee. I'll get with Drusilla and check the meeting schedule, and we'll convene the Cable TV Committee. I mean, some internet is provided by cellular providers and some is not, but
but the Comcast issues definitely are cable TV issues. I've tried to handle those by individuals. And so far, every individual that I've dealt with personally, I think Comcast has accommodated, but this still is a larger discussion I think we should have.
The chair agrees with you. And it's interesting that Cable TV Committee, sometimes we joke it's one of those committees that sometimes doesn't do that much. But at a time like this is a perfect opportunity to use that as a way to leverage and make it a much more active committee, because we've seen where we've got a major issue with just trying to push out educational resources to kids throughout the whole county. And that might be more of a big macro issue, not just for talking after this crisis as we're getting on the other side of it, but for years to come, that's going to be a challenge. Moving ahead, the chair next recognizes Commissioner Biggs.
Thank you, Chairman. Commissioner Jay stole the words right out of my mouth. That's exactly what I was going to say. Thank you both.
Yeah. Great minds think alike. Commissioner Daly.
Thank you, Mr. Chair. I've had a few issues with Comcast, and unfortunately, we lost Katie Brown. She left Comcast about a year ago, and a lady I've been speaking to, Kim Hayden in Nashville, and maybe Charlie, that's who he talked to. She's trying to hire another replacement for Miss Brown, who was awesome. You could call her and everything got taken care of. So if y'all need anything, the lady's contact now that I know of is Kim Hayden, and I can text you her number if you need it.
Thank you, Commissioner Daly. If you could get that sent out to everybody, that'd be helpful. I still I miss Russell Byrd a lot too. It seems like he was the face of Comcast for years. So I think, Commissioner Daly, your light's still on. All right, you're good. All right, Madam Clerk, next item, please.
It's item 39, discussion item regarding County Government Month.
All right, very good. The chair recognizes Commissioner Schoonmaker.
Thank you, Mr. Chairman. The National Association of Counties established County Government Month in 1991. And the whole idea was to encourage counties to raise public awareness of the roles counties play in our communities, as obviously with what's been going on lately. And of course, they established a theme for this year's County Government Month that counties matter. And I think that's a very true statement. And of course, counties operate over 1,900 public health departments. And Commissioner Carringer, in just a minute, will give us a little bit more information about that. But counties are actually one of the USA's oldest forms of government, dating back to 1634. And today, there's actually 3,069 county governments in the United States. And public officials like ourselves and the mayors and the elected constitutional officers, there's actually 37,984 county officials in the United States, which is a pretty amazing number. Kind of some interesting facts that counties own and maintain 46% of America's road miles, and counties actually own 38% of the bridges in the United States. Counties are involved in 78% of the public transportation services. And another interesting fact is that counties operate 91% of our local jails. And nationwide, there's actually 3.6 million county employees. And of course, our Knox County employees have done an absolutely fantastic job during this pandemic. And counties are privileged to serve 314 million citizens in the United States. And I think, and I did want to also mention that I appreciate Commissioner Gill bringing this to our attention, kind of with everything that was been going on, we kind of overlooked it. But I think at this point, Commissioner Carringer may want to add some things about our public health system in Knox County and what a great job they've done.
Okay, thank you, Commissioner Schoonmaker. Yes, as John mentioned about all the Knox County health departments and all the different counties, Knox County falls under like the big four, which would be Shelby County, Chattanooga, and Knox County, and Nashville. We have our own health departments that are ran by our local county, where all the other counties fall under the state. So I guess one example would be when Governor Lee when he releases the order the end of April as far as businesses and whether to go back and all, we have our own health department here in Knox County that will give us the guidelines in terms of not having to go along with all of them that go from the state of Tennessee, that we have our own. And therefore, I think we're very fortunate that Knox County has their own, because we have pretty much anything that you would need to know about your health or keeping safe in Knox County is right there with our health departments, and we have several locations. Of course, everybody knowing that the main one is over off of Central Avenue. So what makes ours so unique is that they are every day studying about what's happening in Knox County as far as what diseases or viruses and all that may be going on. So they are used to studying our area. So that's why I feel like, so far that we've been very fortunate that we've been able to have that upper hand on COVID-19 because of all the work that has been going on in our health department. I think most everybody in Knox County can feel confident in knowing that our health department does have the best interests of all those in Knox County in terms of keeping us all healthy and staying safe.
All right, thank you. I'm the chair. Commissioner Gill, you were actually one of the first folks who brought this to our attention last week, that we didn't have something on the agenda. Would you like to add anything?
Thank you, Mr. Chair. This was my statement, and I guess we can have it part of the resolution, that our county support and maintain public infrastructure, transportation, and economic development assets. We keep residents healthy, ensure public safety to protect our citizens, maintain public information, and coordinate our elections. We implement a broad array of federal, state, and local programs in a cost-effective manner. And I just simply want to salute and say good job to all of us. Thank you.
Very well done.
Yeah, it's a well done, and really for so many of our frontline folks that are out there doing all the hard work. Sometimes we get a lot of press coverage, but really we all know that it's one could argue where we can get the bills paid, but there's a lot of other folks doing really important work. And frankly, this is the kind of thing that we normally would have passed an honorary or resolution on it, but I told Commissioner Schoonmaker, I said, I do want to be consistent, because over the last 2 months, we've had a lot of honorary resolutions that have come before us. And I've said, let's try to postpone those till we get back together face to face. And frankly, I wanted to be consistent and not just pass one to honor ourselves. So as we get through this and get back together face to face, perhaps even it doesn't have to be County Commission month as proclaimed by NACO. We can always pass something to honor and recognize so many of our other frontline folks when we get to that time. So I believe, Madam Clerk, I see Chair recognizes Commissioner Smith. Yeah.
Mr. Chair, to be perfectly consistent, you need to give us one of your pun jokes.
You know what? I'm saving it up for a whole bunch of them for my last meeting, and I'll probably make it an agenda item. So it'll be torturous for all of you. Although I will say I posted, I think, or I shared with a few friends that entry monologue to that TV show we all grew up with called Zoom when we all started watching this. I couldn't get that out of my head. So I promise I will deliver a full slate of puns probably on my going away agenda. But I will say that the gentleman who was at the beer board, I know that he was here with a bar that I think they're also going to cut hair. And first thing that went through my mind was, you go there and leave, and what else can we say other than hair today, gone tomorrow? So I hope that's quick enough for you, Commissioner Smith. So, Madam Clerk, is there anything else on our agenda? And Commissioner Smith, your light's still on. Anything else you'd like to say? All right. Any other commissioners? We've got about 25 minutes till the zoning meeting. So it's a good time to go ahead and take a quick break. And as a reminder, there will be a separate login for a separate Zoom meeting. Right now, we've got the IT team, if you're watching this at home, kind of pulling together a separate waiting room just for all the folks who've got land use things before us to try to get that all teed up and ready to go. So what I'd like to do, I see some hands up. This might be a good chance to make a few announcements and other things related. So we've got Commissioner Daly, then Commissioner Gill. Commissioner Daly.
Yeah, I just want to make sure the law department is okay with our meeting, that we crossed our T's and dotted our I's.
Everything seems proper and ready to go, Commissioner.
Very good. All right, thank you, Commissioner Gill.
Thank you, Mr. Chairman. I wanted to see if Randy would close our meeting with some of his dance moves.
I'll look for a backup from back. You could probably get some dance moves as one of your Zoom backgrounds or whatever. So anyhow, well, friends and commissioners, community, thank you for joining us. I think that's got it. Commissioner Gill, you're wrapped up. And seeing no other hands raised on the digital hand raising board, I'm going to go ahead and wrap up the meeting. And you know what? I might, as a final close, Commissioner Smith, could you state briefly for the record, we passed that hand sanitizer resolution, but we really didn't talk about it in detail. Would you mind, just for clarification? I just got a text from a working reporter who wanted a little clarification on that, and that will be what we'll close on.
And what is your question?
Just the hand sanitizer that we had donated. I know we were going to pass it out to a lot of stakeholders and folks who needed it within our county departments. But we had that. Do you guys know which all the departments are going to be getting that hand sanitizer?
At this point, we do not. We know that our county clerks and our people that deal directly with the public one-on-one exchanging papers will probably be first priorities.
All right, very good. Okay, well, thanks everybody. I'm going to close up the meeting.
Motion to adjourn.
Yeah, motion to adjourn. Oh my gosh, hold on here. Let's see if I can get the dog downstairs to jump again. There's a proper motion to adjourn, probably a second, and all in favor, we're adjourned.
Aye.